WSN was chosen for this project because of our history doing large profile projects in the area that serve the public, and we were able to do them successfully in terms of their schedule and budget. They are also intrigued by our ability to offer all design services within one firm. We provided the architecture, the structural, mechanical, electrical, and civil engineering services, as well as landscape architecture. The interior design, as well as the furniture selection, was led by HGA, and WSN was involved in the initial meetings where we established the goals for aesthetics and the overall look concept for interior and furniture. And then we participated in the design review meetings, offering advice and counsel as we went forward in the various selections. It is comprised of 43,000 square feet on 2 levels. It is a multi-specialty outpatient clinic that offers many services in addition to family practice, women's specialties, a ped center, urgent care, and lab, x-ray kinds of services. And it was a big emphasis for the client on this particular project that we provide patient-centered care, and that the patients feel comfortable when they enter the facility. It is well defined paths of circulation, where to go for different services, and to really create a homey feeling. And we worked very hard with the client to achieve that in this project with natural lighting, the material selections, the furniture, artwork. All of those were part of that. Patients will be greeted at the clinic by a staff member, a greeter, and guided to their specific area of care in the building. And then at that location, they will do the registration step. As opposed to having one large central registration, we have what is called decentralized scheduling. Patient-centered care has a lot to do with the ability to feel like your visit is one-on-one with the provider. And so if you hear voices beyond the walls, it creates an unsettling feeling. We constructed all the walls between the exam rooms from floor to underside of the deck, and they are all insulated, and any penetrations of those walls are sealed. And another common leak in sound is the ventilation system. So we carefully insulated all the ductwork so that sound will not transfer from one room to the next. We tried to create that, what we call an up-north look in this part of the state. We have a lot of log buildings and asphalt shingle, low-pitch roofs. So to fit with the area, we tried to emulate some of that in the choices we made for this building. And because of its scale, obviously we don't use wood siding. We use things like stone. You'll see a little bit of precast, a lot of glass, so that we can make that patient-friendly environment. And then there's quite a bit of stucco on the building and the metal panel roof. My favorite design feature is the natural light. To respond to the request for a patient-friendly environment, we thought that natural light and with the natural views around this site would be a very logical way to accomplish that. So we bring light into the space in many ways. In the large atrium, it comes in at 2.5 stories high and is allowed to light up that deep space with a very interesting quality of light, as well as the patient care areas. Many of the exam rooms have small windows, to help them feel open and inviting, but then also a lot of the corridors in that area end with a window that frames a view of the exterior. My most memorable part of this project, and every project has some, is the dedication of the staff of Essentia Health in virtually every department that we worked with. Their focus on the patient experience was uncanny, unmatched. And also our opportunity to develop a close relationship with HGA in the healthcare planning process.